There are countless times when, had a provider practiced trauma-informed care, it would have had an enormous and important impact on me. I want to collaborate with my providers about my healthcare. I want to feel like we're on the same team. I had a near-miss event during labor that was so severe that I was later diagnosed with PTSD. The event was terrifying, and I knew that if I could understand it better, that it would help me process it. I went to the doctor with a written list of questions. His attitude, his demeanor told me he didn't have the time for me or my questions. He listened to a few, but then he thought I was taking too long. So he took the list from my hands and started giving short answers or skipping the ones that he didn't think were necessary. I completely shut down. There are things that I still don't understand from my near-miss event, and I guess I never will. I have extensive trauma history that goes back to my childhood. Someone that I should have been able to trust violated me as a child. And this is something, whether I want to or not, I bring with me when seeking health care. And it's not something that a provider could know just from looking at me. And there have been moments during exams that providers made me anxious simply by their positioning in the room. Some stood really close, I think, trying to connect, and for some patients, that might bring comfort. But for me, what I felt was them blocking the exit and being in my space. It was a trigger. I felt more at ease when providers stood further back, not in a power stance over me. Then there were times when providers abruptly handled me, like when they grabbed my wrists to move me during an exam, when they could have asked me just to reposition myself. Doctors have given more validation to my husband's concerns than to mine, even when I was the patient and had asked the same questions. Providers have made comments about my body or weight that made me feel ashamed. There have even been times when sharing my trauma history with a provider that have backfired because they write off anything I'm experiencing as just being part of that history. It's like that saying, death by 1,000 paper cuts. All of these small, separate moments build into something bigger and interconnected, and I end up carrying the impact of them with me into future interactions with providers. Everyone deserves to feel safe and seen when they're seeking care, no matter what. But for people with a history of trauma, a bad experience can quickly snowball into something larger than just an unfortunate interaction. That creates barriers that are hard to overcome, so that I might not even seek out care the next time I need it. That can have devastating consequences.